We are in a healthcare crisis right now.
The state's health director issues a dire warning. Our medical problems go way beyond just our public hospitals. It seems to be a never-ending list of setbacks. Just this week, layoffs at Kona Hospital and mandatory cutbacks at Hawaii's state-run hospitals.
But today, the state's top doc says our private hospitals are also in the midst of a crisis. KHNL News 8's Leland Kim has the sobering details in tonight's top story.
Dash and Steph, doctors are concerned about our state's healthcare crisis because there's no relief in sight and there are no simple answers. We're talking about every single hospital in Hawaii, including the state's only trauma center. The Queens Medical Center is where the people of Hawaii go when they have serious medical problems. But even the state's only trauma center is facing hard times.
I think it's important to emphasize to people that all of our hospitals are experiencing a financial crisis right now.
The state's health director says this healthcare crisis extends to both public and private hospitals.
Every single hospital in this state is faced with similar issues of being under-reimbursed, of having mounting costs in order to provide quality care.
Whether public or private?
Doesn't matter. Every single hospital in this state is faced with similar financial difficulties.
This is especially true for neighbor island hospitals.
We know that physicians have left town, that there's not a whole lot of interest in setting up practices in rural communities.
But even our most populated island faces some challenges.
Yes, there are a lot of services on Oahu, but there are also a lot of people. And we find increasingly more and more people are unable to find a primary care doctor to take care of them.
This means doctors, lawmakers, and ordinary citizens need to work together to come up with a solution before hospitals start closing down.
We are in a healthcare crisis right now. And I think people feel comfortable because when you look out across the street, the hospital, the brick and mortar is still there. But the brick and mortar of all of our hospitals is only one piece of a healthcare system.
A facade on the verge of collapsing if changes don't happen soon. Doctors say the best way to minimize the impact on you is to take preventive measures, eating healthier, exercising, and seeing your doctor on a regular basis if you have chronic conditions. Reporting live, Leland Kim, KHNL News 8.